one of the things we've tried to do is listen to you all. And so when you've said to me, hey, I'm interested in working for a nonprofit, can you try to find someone to come in and speak to us about nonprofits? I am delivering today on that promise to you. So we're very, very honored to host Liz Dickey, and Liz is the Executive Director for Health for All, which is a local nonprofit here in Bryan College Station. And I'll let her tell a little bit more about what she does. She has a Bachelor of Science in Marketing and Supply Chain Management from Syracuse, as well as a communications minor. So she's worked in quite a few different roles, and I imagine she'll tell you a little bit about her background and how she got to where she is today, and a little bit maybe about some of the challenges. And then this is just going to be an open dialogue, and so we're hoping that you came with some questions that you have about working in nonprofits, how you get those kinds of jobs. And so I'm going to turn it over to Liz, and then we'll have some time for question and answer.
Thank you all for having me, or requesting me, I guess, in a roundabout fashion. I'm delighted to be here, and like she said, this is very informal, so at any point, if you have a question or a thought, please don't hesitate, just shout it out, and we'll make sure we cover all the bases. So, Health for All, how many of you guys are familiar with Health for All? Have ever heard of it? All right, there's a few. It's kind of a well-kept secret. People that know about it tend to really, really like it, so that's a good thing. But a lot of folks in this community don't even know it's a resource that's there. It is a free clinic for the uninsured. So it is currently located on Memorial Drive, just behind St. Joe's Hospital. And we act as an affordable option for people who need health care. That typically they're the working poor. So these folks have jobs, they're trying to do their part to take care of their families and themselves, but they either don't have health insurance through their employers, or they don't have the option, or they can't afford it. So rather than leaving them with nothing and then they get to the point where they have to go to our emergency rooms for their health care, Health for All has asked local doctors, nurses, medical professionals to volunteer their time to come in and take care of these patients in a clinic setting so that we can take care of chronic diseases, a lot of hypertension or diabetes, and make sure that we aren't leaving these folks without an option so that they wind up in our emergency rooms. A lot of folks don't think it impacts them. I have insurance, or my parents have insurance. It's not a very sexy topic. Why should I care? It impacts anyone. Anybody that is an employer. I know a lot of folks in this room will probably have a business at some point. If you provide health insurance, you're going to be paying costs for people who wind up in our hospitals that don't have insurance. Anyone that pays taxes, it's going to wind up paying those costs for folks that go to our hospitals and don't have insurance. And obviously our hospitals and healthcare professionals are going to have a huge burden from people who aren't getting their healthcare through the proper channels, and we're trying to help alleviate some of that. So we do rely on volunteers. It's a little different dynamic when you're trying to manage employees that have wages versus volunteers that are doing it out of the goodness of their heart. So it can be a challenge to add to kind of the management side of things. On the flip side, they tend to be very dedicated and have a passion and purpose towards your mission that a lot of times you're hopeful you can get your employees to strive to that level, but you're not always successful. So there's kind of pros and cons to each side. I have been an executive director at Health for All for the last year. My background has nothing to do with nonprofit. I was in a company that brokered compressed gas. So I did everything from sales to marketing to customer service representative, made some serious money, and decided that I needed something more. When I asked the president of our company, by the time I had gotten to a C-level executive and were in some of the meetings where I could kind of interface with the leadership, what our purpose was, how could we motivate our employees to actually help us get our goals that we were trying to strive for. He said, well, every business has the same goal, it's to make money. And while that is a function of being in business, you're not going to be around long if you're not making money. That shouldn't be your purpose. Those are two distinct things. So I quickly set about looking for somewhere where I could have a bit more purpose, and through luck would have it, I have a mother in the medical industry. I don't know how many people have heard of Dr. Nancy Dickey. She was formerly the president of the Health Science Center. She's now actually works for me as our medical director at Health for All. So, kind of different spin on things, but she was the first female president of the American Medical Association, has a lot of connections in the medical industry, and luckily I had an in to try to get her to work for us. So it just happened that somebody got my name, and I will never know because they won't tell me now that I've got the job, but I am almost certain that they thought they were getting a different Dickey when they called me to interview. Luckily, I went through the process and they liked what I had to say, so I am really enjoying it, but it is a different challenge every day of the week. I don't know that I had any inkling what an executive director did. I certainly didn't think about the fact that I was going from a larger company to a smaller one, which means as an executive director, if we don't have a position, it's me. So IT, hi. Yeah, I mean, anything and everything. Janitorial, that's me. You can't have a lot of pride. You have to be driven, and you have to have a passion for what you're doing, or you won't last very long. But I have enjoyed it, and I have not been bored once. So, do you guys have specific questions you want me to cover? Yeah. We'll start with you. Put you in the back. Yes.
So I guess I love what nonprofits do, but I can see that self-motivating would be an issue, especially on a daily basis when you do, as you say, have to play several different roles that you might, not like to play. How do you motivate yourself every day to continue doing what you do, especially when you came from a previous lifestyle where maybe, for example, if there was less stress as far as financial aid and support for yourself and for your cause?
Excellent question, and it's something that the industry struggles with. The burnout rate for executive directors in particular, but in nonprofits, is much higher than anywhere else. I personally have done it by collecting successes. Every time we have a patient that gives good feedback, every time we have a volunteer that comes in my office and tells me what a difference we made in their life, I record that. I keep it. Every thank you letter I've gotten, I have them all stored in a box. And when I'm having a particularly rough day, if I didn't get that grant I applied for, if a doctor says, hey, I'm going on vacation, so you don't have anybody to staff your clinic next week. Anytime there's a stressful situation, I will pull out that box. And when I read about the single mother who didn't have any way to get health care, she couldn't afford her $100 vial diabetes medication, and truly was at the end of her rope when she found out about Health for All, it pushes me to get over myself and to go back out there and keep doing it.
Yes, ma'am. Could you go into more detail about your funding stream? I saw online that you guys don't receive any state, local funding, and it's mostly local donors. Do you guys do some sort of fundraising events, or how are you doing all that?
We do. We actually have one coming up in April, which is a luncheon. We typically have at least 2 fundraisers that we hold per year to help offset some of the cost. We're a little different, especially in a healthcare setting, to have a nonprofit that doesn't receive any government funding. There's a few reasons for that. One, I think that what we do is highly detail-oriented a lot of times on a one-on-one basis. If we don't have the flexibility to say, okay, this woman has an abnormal mammogram result and we need to navigate her through the system to get the best possible follow-up, basically knocking on doors until we get somebody to donate their service or until we get the x-rays that we need donated. We can't necessarily do that when we're trying to comply with a federal mandate saying you have to achieve X number of mammograms, X number of follow-ups, X number of whatever it might be. So while the plus of having some of that federal funding is obviously we're all hurting for money nowadays, it's a tough economy, But on the minus side, there's a lot of restrictions that come with it. And Health for All has chosen, with the population we're trying to serve and the way in which we're trying to fill a void that other agencies might fill, is that we would rather not accept federal funding, and we go after local corporations, local individuals. There's a lot of companies in this community that have been extremely generous with us. There's a lot of companies that have employees that don't have health insurance as an option, whether it's because their hours or because the employer is small enough that they just can't provide it. They'll actually work with Health for All to provide a donation to us and then encourage their employees to seek their health care through us. So it's not a health insurance plan by any means, but it is kind of a way that they can make sure they have access to health care and they can fund Health for All. Mm-hmm. Yes, ma'am.
You talked a little bit about it in your last answer, but could you just tell us about the kind of services you provide?
I can. We have, obviously, we have physicians that volunteer their time that give exams. Most of our patients have chronic diseases, so a lot of it is going to be maintenance of diabetes, hypertension, COPD. So every 90 days is in a best case scenario, if they're in compliance with whatever levels they need to have, they would come back to check in to make sure everything was going well. In addition to that, we do all of their lab tests and x-rays for general things. If they need something above and beyond, there's some really expensive tests that we don't cover, but we'll work with them to try to get. We do a number of referral programs where a lot of times we had either dentists or optometrists that would come to Health for All. Because so many industries have their own issues right now, making sure they're getting their quotas and seeing the number of patients they need to see, they've decided it's more economic for them to have us send patients to their offices. So we have a number of places that work with us for dental, vision, that we can actually refer out to different practices in town. So we consider that kind of part of the services that we provide and then help navigate them through. We do mammograms and work with local agencies to do colonoscopies. But one of the biggest things that we do for our patients are medication assistance programs. So we work with the drug companies that actually manufacture products I will not give the brand names, but in order to keep them from having to pay these exorbitant amounts for their prescription medications, each drug company has a different application and different criteria. We have someone on staff that's job it is to walk each patient through the process and fill out an application for them, so that if they are eligible, we will get their medications free of charge sent to Health for All. If they are not eligible and we have deemed that they are still someone that needs assistance with that medication, Health for All will pay for it out of our pocket. So, do you have a question?
Yes, ma'am. So today is the end of open enrollment for the Affordable Health Care Act. How do you see these individuals, many of these individuals may or may not be getting health insurance, how does that impact a clinic like Health for All?
Well, in theory, and I've gotten this question a lot. Excellent question, by the way. In theory, and especially when they announced this 5 years ago, the thought was that Health for All wouldn't be around. Once this was fully implemented, what would you need a free clinic for the uninsured if you don't have any uninsured? It just didn't add up. In reality, it's not gonna impact us as much as we would like. We would ideally love to be put out of business. That's not gonna happen. Anyone that is here either undocumented or without the proper, citizenship papers is not eligible for the Affordable Care Act, which means that they still need health care and they still can't be refused from our emergency care rooms, which means right now that's their only option, except for Health for All and light clinics. The other is that if you are below 100% of the federal poverty line, you are exempt from having to purchase insurance. And a lot of our patients fall within that criteria. Because the law was written so that all of the components would build on one another, they determined that anyone below 100% of the FPL would have access to Medicare and Medicaid expansion. Texas chose not to do that. So we've left a chunk of our population without coverage and without an alternative. The other thing that we've run into with some of our patients, even that are above 100% of the FPL, is that the only way they plan to assess any kind of a penalty is through your tax return. The vast majority of the patients that come to Health for All do not have a tax return, whether it's because they don't have enough income or any income to actually do one. If it's because they just choose not to hassle with it, I couldn't answer that. But the reality is we have been pushing our customers to try to go and sign up, see if it's something that might be feasible for them. And we have had one patient out of our 500 patients that we've talked to that signed up or that looked at signing up. I don't know that they actually completed the process. At some point it may lower the numbers that we're having to deal with, but for the foreseeable future it's not going to have an impact. Anybody else? Yeah.
I find it interesting that your medical professionals are volunteers. Could you talk more about the management of them and, if you have some sort of retention rate and staying for long periods of time?
Well, we just had a big shift in that, so I will do my best to answer the question with the caveat that we're learning again. We had a huge group of volunteer medical providers that helped Health for All on a routine basis. They were a little older, mostly had either retired or were about to retire when we shifted to an electronic medical record system. So we went from paper charts to an EMR, and a lot of the volunteers that were working for us said, it is not worth it to try to learn this computer system. I'm doing this out of the goodness of my heart and have no need to go through that process. So if you'll let me keep working with the chart, I'll stay. If not, I'll go. And at the time, we determined we really needed to encourage everyone to adopt the EMR. Otherwise, if nobody is willing to try it, we would never get there. So we're just starting to build back on our volunteer base with a lot of the newer docs in town or some of the ones that have been here but haven't volunteered with our EMR system, and we're kind of approaching it like we're building a brand new volunteer base. But typically, once a doctor has had a chance to come in and see some patients at Health for All, they really do enjoy it. It really is like doing a mission trip without having to leave. You can be home for dinner with the kids and the wife or your family or whomever they are without ever leaving town. And you have the added benefit of knowing that you're doing something good right here for our community. So there's a lot of selling points. The biggest problem is making sure that your hours are convenient for when they want to volunteer.
I guess we have students who will be graduating in just a few short days. They probably have it numbered down. Any advice that you have for new professionals entering the field of nonprofit management?
I would say let what you don't know work for you. The biggest thing that I've run into being in a role as someone not trained in nonprofit management have been the number of people that said, that's not how we do it. That's just not the way it's done. And when you go on to question why that is, a lot of times it's just because no one's ever approached it differently. So I've had a unique ability to come in with a perspective that a lot of folks don't have from the corporate side of the for-profit world trying to make decisions for a nonprofit. And I understand that they don't always correlate, they don't always translate, but a lot of times you can do a lot of good if you know how to look at something differently. So my biggest advice would be don't go in thinking you need to know what they know. Go in and embrace the fact that you don't know, that you're coming in without that 20 years of experience, and use that as a selling point. That would be my biggest. Anybody else have questions? All right.
What do you feel like are some of the challenges facing nonprofits?
One of the biggest is obviously just the number of dollars out there and the number of causes that are going after them. Especially here in Bryan College Station, we have a lot of wonderful nonprofit organizations that are all trying to go after the same donors, trying to make those same relationships. So I think really funding is going to be one of the ongoing things. I think that a lot of us, while we all acknowledge that we're trying to put ourselves out of business, I think we could do a better job of communicating between different agencies to make sure that we kind of eliminate if there's redundancies, if there's things that we could better benefit our clients by working with whoever it is, whether it's for-profit, nonprofit, whatever resources are available, rather than trying to reinvent the wheel using what we have. I think a lot of times in trying to make ourselves relevant, we work harder at trying to do something that maybe somebody else is already doing. And I think that's a challenge, getting outside of ourselves to say what we can do that's in the best interest of our clients rather than for our agencies. Yes, sir.
Let me ask you a broad question. You can take it whatever direction you want. But I'm kind of curious as to what you actually do day in and day out. So there's probably not a typical day in your job as an executive director. That might be a lesson as well. But if I asked you, describe for me what a typical day is like for an executive director of a small nonprofit, what would you say most of your time saying, and what kinds of things are you doing?
Well, I mean, as an executive director, I'm responsible for pretty much anything and everything. So there are really not 2 days that look alike. I know that today I was in meetings with other agencies all morning trying to, again, talk about the best way that we can utilize resources. A lot of times I'm out of the office so that I can go and build relationships with local companies and donors to make sure that I have feedback on where they think their dollars are going, and that I'm communicating what we're doing when they donate to us. Days that I'm in the office, I will work on ensuring that our volunteer providers have everything they need, that they have had kind of the orientation and introduction to Health for All and our EMR system, making sure that the clinic is flowing, that our patients are happy with the services that we're providing them, making sure that our volunteers and staff know who I am and that they can approach me if there's something that needs to come to my attention. Grant writing, that's always a favorite. There really is, every day is a little bit different. We're currently looking at finding a new home for Health for All. St. Joe's is planning expansion, which is going to kind of make us look elsewhere. So I am talking to contractors, I'm talking to media folks about trying to launch a campaign so that we can get as much as we can possibly get donated, working with an architect to see, okay, if this is our ideal and this is what we can afford, how can we mirror the two as best as possible? So each day is a little bit different, but some of those donors and fundraising is a big thing that is throughout, and then managing volunteers and recruiting volunteers is a big thing. But.
Okay. You mentioned earlier that you have about 500 patients. Is that near the capacity of what you can provide for the community? And given the fact that you just mentioned about how resources are difficult to get sometimes, what happens when you get nearer to that capacity of what you can provide for the community?
Well, we have, for the last several years, we actually limited our patients to only chronic disease management, and that's recently changed to include acute care. So if you had a sore throat or something, you could come in. So that changes our numbers considerably. We went through The year before they hired me as executive director, we went through several changes. Our executive director had a job offer and actually went to work at A&M's foundation. Our medical director got a job with the American Medical Association and moved out of state. So we were kind of rebuilding things. Typically in a year, we'll actually provide roughly 5,000 patient visits to more than 1,000 patients. Currently, we're working with about 500 unique patients, and we're providing, if we average it out, it'd probably be 3,000 to 4,000 patient visits. So we still have some capacity, and we're hopeful that as we're working on building that up, we can also recruit more doctors, more medical professionals, nurse practitioners, physician's assistants that can donate some time that would just add to the ability to build on that. Yes, ma'am.
You mentioned that you all see those who don't have the proper documentation or paperwork. Do you find it hard at first to convince them that they can come and get health care? I mean, are they scared, or is it
Yes.
you don't know that that's, I mean... Yeah.
Yes, that is a huge issue, especially if you come in as a new patient. We have the standard new patient packet and clipboard that we hand you. If you feel like authority has typically been something you needed to shy away from, and that the more questions people ask, the more likely it is you're going to get in trouble. And we have a lot of patients that do feel that way. Most of the time, patients find us through other patients. So a lot of times we will just work with patients that if we know that they're sending someone to us, we'll ask if they can be there at the first visit just to kind of help calm nerves. It helps if we have a physician that will speak Spanish so that they can directly talk to them about it. But yes, it is an ongoing something we have to deal with, and we haven't found the best way to deal with it, but those are some of the approaches that we try. Yes, ma'am.
Along the same lines, what percentage of your budget goes towards marketing?
In the past, we have not had a separate line item for marketing. In this coming budget, we're actually planning to add it. And I don't know what the percentage is going to be, but it would be less than 5%. It would be a small number, but since we've never actually allocated money towards it, it's something that I felt was important. The number of people that raised their hand that knew what Health for All was, that's sad. If there's that many people in our community that need this resource, the only way they're going to find us is if they know that we're there. And so we feel like that's something we really need to raise awareness about, but that'll be a new thing. Yes, sir.
So I have 3 questions for you.
Okay.
First one, if you can go back to the issue of, you use the word or the term communicating with other agencies.
Mm-hmm.
So can you elaborate a little bit more about collaboration with other agencies, the benefits and the challenges? And I think some of my students here, we actually discussed that last week in class. The other question is what is the number of your staff and what is the number of your volunteers? And the third question is based on your experience and taking your organization as an example, what kind of jobs are we looking for in the nonprofit sector in the coming 2, 3, 10 years? I know that the last question might be a little bit hard, but...
Okay, I'm going to start with staff because I can nail that. We have 6 paid staff, and then we have more than 200 volunteers that supplement that. For the collaborating with agencies, we have, there's a lot of different ways that we try to do that. The first step is always going to be just starting a conversation, making sure that you can get folks to the table. Sometimes that's a challenge in and of itself. Usually in this community, we haven't had too much of a problem starting the dialogue. It's when you need to take action that you run into some of the problems. One of the biggest things is when you're trying to collaborate, again, one of the things that agencies struggle with is making sure that their agency remains relevant versus making sure that they're looking at what's in the best interest of the clients that we're serving. It's an ongoing challenge, and I don't know the best way that you can try to address that other than going in with your eyes open, that's going to be something you'll run into. I don't think that anyone would consciously do something to hurt the clients that we're serving. Most people that are serving in nonprofits have a good heart, and they're there for the mission or the purpose. But it is also a business that people are trying to make themselves and their agencies successful, and that's part of what our jobs are. But being aware of it, it's a lot like when you watch the news. If you're aware that there might be a bias and you're asking the right questions, sometimes that can go a long way towards getting to the right truth, I guess, the heart of the matter. A lot of times you have to just take a step back and make sure that you're asking the question in every interaction, whether it's with your staff, with collaborating partners, with the community. What is in the best interest of the people we're serving? And defining who that is. I mean, if the people you're serving are your donors, that may be a very different answer than if it's the patients that we're trying to take care of. And I think part of that is determined by your board of directors. And as an executive director, it's your role to make sure that your board of directors has the information they need to properly govern the agency. And so it's having conversations like that and making sure that everyone's on the same page with what you need to be doing when you're out representing in the community. Did I kind of answer that? Okay, and then what was the third question? Jobs that we're going to be looking for. I think one of the biggest things, and I think this is across the board, whether it's nonprofit or for-profit, is going to be folks that can wear multiple hats, and folks that kind of want to wear multiple hats. Some people have the ability to, but they don't have any desire to go out and tackle 3 or 4 different jobs. I think that we are in an age where we're asked to do more with less across the board, and I think that folks that have that inner drive, that have an inner motivation, or know how to figure out how to propel themselves to do good work, whether that motivation is your paycheck, whether it's doing a good job, whether it's praise from coworkers, or whatever it is, if you identify it and can let your employers know what you need to perform for them, I think those are the kind of jobs that we will make sure we have jobs for those employees as we find them. If that answers. I'm a little bit different since we're a medical base, so mine would be mid-level providers. There's going to be a lot of room for growth for physician's assistants and nurse practitioners as we're kind of expanding the burden on our healthcare providers out there. There's going to be more and more need for them. They're going to be faster to train and get out into the field than physicians, and that's likely what we'll see an increase of. Yes, sir.
How do you identify and reach out to potential donors, and then how do you become comfortable asking strangers for money?
I think especially you're new, relatively new in your position. That's so good.
I don't know that you ever get comfortable asking for money. If you do, I don't know if you're doing a very good job. I don't know that I'd want to give my money to somebody that was just comfortable asking me, like, just to take it, because then they're not going to treat it as the gift that it needs to be. The way that we identify potential donors is always keeping our eyes open. Anytime, I mean, there's a difference if you're looking for a potential large gift than if you're looking for just someone to support your agency, because anyone can support your agency, whether that be volunteers, students, patients. Anyone that has any interaction or knowledge of your agency can be a supporter of your agency, whether that's $5 a month or whatever they can afford. If you're looking for large gifts and you're going to go ask for $10,000 to $20,000 at a time, it's a little different. But a lot of times, we live in a fairly small community where we all know who those funders are, so it's kind of already been established who the big players, I guess, are. And it's just about building a relationship with them. So it starts with if somebody has an introduction, you need to know somebody that can introduce you, whether it's a board member or a friend or a family member, somebody that has an in with them. And if not, then you need to start networking so that you can find somebody that has an in with them. So it's a lot about relationships. It's a lot about going out and joining clubs or organizations, not just for the sake of joining them. You should by no means go and be a Rotary member just so you have somebody that can introduce you to Mr. Jones. But you should go and get involved in your community and start building these relationships, because it will pay forward, and you will be able to help them in return. The folks that you make these relationships with, the next time they need something, they'll know who to call. I've had people call me to say, hey, my neighbor has somebody that doesn't have health insurance that needs dialysis. What can we do? And we'll walk them through the process, and that's something that we can help one another out. But to really get to the heart of it, you don't ever get comfortable with that, and I don't think you should. Yes?
Given that you rely on skilled volunteers for your organization, one, how do you recruit them? And then two, whenever you have someone who's interested in volunteering with Health for All, what kind of vetting process do you have to make sure that when they're a right fit for your organization, that they're going to be able to provide the services?
Well, it's a very similar process to recruiting donors. Most of the time you have to have someone that can make an introduction, and it's again about building relationships. So you could just cold call, but your success rate's not going to be nearly as good than if you have, hey, Dr. Haji, who created our clinic, happens to know Dr. Jones and can set me up a lunch date or an appointment, and then you have some common ground that you're starting with. Luckily, we were started by a local physician that has a lot of connections in the medical industry, and it's still his baby. I mean, he still volunteers when he's in the country and has time, so he a lot of times is making introductions or telling other physicians, hey, this lady's going to come talk to you, you need to let her in. So a lot of it is just making sure you can get in the door. Once we have them signed up and interested in doing it, again, it's a little different since we're actually dealing with medical professionals. St. Joe's Hospital has been kind enough to donate the credentialing process, which typically would cost a nonprofit money. They do that for us as an in-kind donation. So any physician that is interested in volunteering, if they're already credentialed through St. Joe's, then we get to skip that step and we can just have an orientation about Health for All patients. If they're not, then we will go through that process. So once they're credentialed and we know that they have the proper licensing and can take care of patients, the biggest thing that we have to do is less a cultural fit and more making sure that they understand that our patients are going to require a different kind of medicine, not less quality. And unfortunately, a lot of doctors equate changing their approach as giving inferior quality, and that's not at all what we're asking. We're trying to be realistic in the fact that if our patient can't afford a medication, the chances of them taking it and being compliant, it's just not there. So you're wasting the patient's time and your time if you're trying to use the approach you would use in your private practice and give them that name brand drug that they're never going to be able to afford. What we have are treatment protocols. So we've had our medical director and our medical staff have gone through and said, okay, if you have diabetes, this is the approach we will take, XYZ. If their sugar levels are here, we do this. These are the drugs that we'll use. These are the the medication assistance programs that are offered. So every physician that comes in, or every nurse practitioner or physician's assistant that comes in, has basically a cheat sheet of how they need to deal with each of the patient's main situations that we might run into. Yeah. Yes, sir.
Do you have any foreign citizens among your staff or patients?
Patients, yes. Staff, no. And I don't know that it's for any reason other than that most of our staff have been with us for 15 years, and they're there's a pharmacy tech and a nurse that have been there. We would love to have some different languages that were spoken from our staff. Currently, we are very undiverse in our staff, our paid positions. And I don't know that that's for any reason other than that's the folks that were interested in filling the positions when they were available. But yes, our patient population is hugely diverse. There's a lot of different countries, and I mean, we have a little bit of everything covered. Is that? Yes, ma'am.
Me? Okay. This is a long question. I had to write it down. Sorry. Okay. So, how much interaction is there between your staff and board? And then, are there struggles that you see with being the middleman between the two? Because you have interaction with both, I'm sure. And then, do you have any advice to give some of us who may be managing, be in a similar role as you, and having to manage that relationship?
Wow. Okay. I think every board's going to be a little bit different. Our board is actually currently 11 members. It can be 9 to 21. So your bylaws will set out minimum and maximum number of board. Their interaction with our staff is going to be kind of dependent on their interaction with your organization. So ours is a clinic, and most of our board members are not medical professionals, so they have very little interaction with our clinic. They might see the staff if our board meeting is at the clinic and the staff is still there or comes in to say hi, but otherwise they don't really, and it's not for anyone wanting to keep it separate, it just happened that way. For a long time, a lot of our board members were doctors who actually volunteered at the clinic, so they had a much stronger relationship with our staff than our current board does. I am the go-between between the board and the staff, because the staff is carrying out day to day, the board is setting the overall arching mission of what we're doing. You have to be able to communicate across that channel. Was the question about what the challenges are in doing that?
Do you have advice for us in the future?
Well, the biggest thing I had to learn and that I struggled with initially is that essentially your board of directors is your boss. So you go from what would be normal, I guess, of having one supervisor to having a body of supervisors. And technically, they can't actually take action unless they are all in the room together and using their voice of a board of directors. So you may have Joe and Mary who sit on your board who have two totally different ideas, and they individually will talk to you because you'll have to have relationships with your board of directors outside of when you meet as a board. And you will have to kind of politically navigate all of those different opinions. And then once the board of directors comes together and has a voice, you'll need to be able to adopt that and make sure that they adopt that. Hopefully you will have a strong president or chairperson that can help do that. But I think my advice would be that you need to go in prepared to kind of be your own boss and to help facilitate so that your bosses are doing what you think they should be. If that makes sense. It is really kind of a weird structure that as an executive director, I am responsible for my board of directors knowing what they need to do and doing it, but they have ultimate say over whether I keep my job or if I'm doing my job. So it's kind of weird. It's my responsibility to teach them and make sure that they are doing it the way I want it done, and then they get to say if the way I want it done is right, I guess. So. Yes, sir.
Since some of us won't necessarily be executive directors of nonprofits, but maybe on board of directors for nonprofits, what advice would you have as a spinoff of that to folks who are directors on a board, either of a nonprofit in the medical service industry or more generally speaking?
The first thing I would say is that if someone asks you to serve on a board, ask them what those expectations are and make sure that they have a good answer for you before you sign on. I am on a couple of boards, and I also work with my board. So I have a couple of different perspectives. Whoever is in charge of recruiting should have an idea of what your financial commitment should be, what your time commitment should be, and what kind of support they're going to give you to make sure that you can do your responsibility to be a good steward of the organization. So a lot of times they're looking for particular representation, whether that be we need a lawyer or an HR person or a whatever it is. Make sure you know why they're looking for you, what it is that they think you're bringing to the table, and make sure you're comfortable bringing that to the table. Then once you have kind of the foundation of what you're going to be expected to do, I would just say don't be afraid to ask. A lot of times I think that your board of directors, like I said, they're my boss, so they might feel uncomfortable asking me a question that they feel like they're supposed to know. It's my job to make sure they have whatever they need. And so it really is about making sure you have a relationship with whoever that is, whether it's an executive director or your board chairperson, and don't be afraid to ask. I mean, you're signing up to legally be responsible for the decisions that are being made, so you need to make sure that you can do that and comfortably hold your part. Is that? Mm-hmm.
I think we have time for probably one or two more questions. I guess I'll start with one.
Okay.
Is there anything that you wish you would have known before you got into working for a nonprofit?
I wish I would have known that an executive director meant CEO / everything else. A lot of people may know that. I did not know that when I actually came into the role. I wish I knew how much of it was going to be selling, donor solicitation. You sell to anybody and everybody. You sell to volunteers when you're trying to ask them for their time. You sell to donors when you're asking for their money. You sell to the community when you're trying to hold fundraisers or when you're trying to get the word out about what you're doing. You have to have relationships, and you have to sell to all of the media outlets if you're wanting any kind of coverage. So anybody that's uncomfortable with sales, I wouldn't discourage you from getting into it. I would encourage you to get more comfortable with sales. I think that it's something that you can use in any position, anywhere, and it will make you better for it. But I wish I had known that going in. So.
One final question from the audience. Who wants it?
I got shy all of a sudden.
No. There you go, Bree.
Yeah.
Yeah, you talked a lot about all the changes that have been happening since you've been an ED there. I was wondering if you could talk about kind of the challenges of managing that change.
Well, one of the biggest, I talked about some of the longevity of the staff that has been there. Part of what that means is that this staff, if you consider that the average executive director will last 3 years, a lot of times it's less than that. If you consider that if you've been there for 15 years, how many bosses you've cycled through, and then you have a new boss that's coming in that's young, not from the industry, not a healthcare person, just consider how you would feel in that room if you had somebody coming in introducing themselves as your new boss. That's the biggest challenge, is getting those defenses dropped so that you can start having conversations. You can start making sure that they know why you're there and why, if you're making changes, what those changes are, and getting their buy-in for it. I think one of the challenges that any nonprofit faces is that people who are on the front lines dealing with clients tend to get burnt out and run down. They deal with a lot, and they have good hearts, and they all got into it the same reason that anybody else would. They're wanting to give back, and they believe in the mission, but you can only take so much before you start putting up walls. And if you don't have something in place to help them connect to the reason they got involved, if you can't share those success stories, you're going to be fighting a downhill battle. And if your staff's not on board, it's going to be really hard to get other people on board to have the kind of culture in the place that you want, so that people want to be there and they have the kind of support they need to take care of the clients. So.